So, welcome to Hypnotherapy Reflections, from training to practice. Today we have Kevin Mitchell-Casey with us, someone who's very experienced in the world of mental health, and ultimately went on to train with CPHT as a solution-focused hypnotherapist, as well as all the other work he's done for a while now within mental health across the board. So we'll explore his journey, the unique insights, both personal and those gained from training at CPHT, and the powerful impact solution-focused hypnotherapy has had since he's trained. So get ready for the inspiring conversation highlighting the transformative power of hypnotherapy and the exceptional training provided by CPHT. So Kevin, welcome.
Hi, Gary.
I think, first of all, we better get you to introduce yourself and who you are, what you do, where you practice, all the basics.
Hello, everybody. My name is Kevin Mitchell-Casey. I'm a solution-focused hypnotherapist. I'm based in a little village just outside of Boston in Lincolnshire. I work with anybody who comes to me and asks for help. I think that's what we all do as therapists. And I will work for a short length of time or as long a length of time as the person asks to do.
Fantastic. So that's really fact that you're in a small village in Lincolnshire. Many people think you have to be in the middle of London or the metropolis, but you're really comfortable working at a small village, and people know how to get to you, and it's quite a good community, I guess.
Absolutely. I mean, Zoom has made the world tiny, really.
Yes.
So recently I've worked with somebody in Abu Dhabi.
Wow.
Needed issues with alcohol. I've worked with somebody in Aberdeen,
Yeah.
and certainly anywhere around the country. So Newcastle, Nottingham,
Yeah.
outside of London. But yeah, the world is tiny now.
Well, that's fantastic. So it really doesn't matter where you work. And
No.
interesting, I interviewed a graduate who graduated in Essex, but she comes from Norwich, but now she's traveling the world. And that's exactly what she said. So we can see that particularly this modality is really helpful to anyone,
Yeah.
whoever they are, because they can contact you and work with you wherever you are. So that's fantastic. What I want to ask you is, what motivated you to pursue training as a hypnotherapist?
Years ago, and I mean in the 70s, I met somebody who was a hypnotherapist.
Wow.
We were chatting about hypnotherapy. He trained as a straight hypnotherapist, you know, the old watching thing.
Oh, wow. But it was a long time ago.
It was a long time ago. And I was interested in it, but I had lots of other things going on in my life. I'd just
Yes.
recently got married, children, all that sort of stuff. And so I didn't pursue it. And then about 7 years ago, I was in a library and I picked up a book called Trance by a chap called Michael Yapko. He's well known.
Yes. Yeah, Michael, I've seen him in conference, so
Have
he's
you?
very good. Yeah.
I wish. Um, and I was in my early 60s at this time. And I thought, okay, let's have a look at this. So I read the book, and then it made me decide that actually hypnotherapy does appear to be very, very powerful.
Yes.
So I did what everybody else does, Gary. I went online to try and find a hypnotherapy trainer.
Yeah.
Okay, PhD. And you. So I was
Ah.
very.
Well, I was going to ask you that question later, so we might
Right.
do a full circle back to that. I'm quite interested because you obviously, got a little bit of interest peaked in the 70s, and that sort of stayed in the back of your mind, and and stumbled across Michael Yapko's writing in more recent times. But what was you doing between the 70s and when I met you in 2000 and whatever?
19, I think it was. I was working as a nurse. I've been a registered mental health nurse since 83 when I started my training.
Wow.
So a good few years now. And I love the job. I really do love the job. But what I discovered was that over time, when people became more interested in what we do, and NHS started to silo people. And what I mean by silo is that if you were a nurse, you were expected just to nurse. And if you're a
Yes.
therapist, you're expected just to give therapy. And that's absolutely fine. But the reality is, nurses can do more than just nurse. We can do.
Yes.
I've done therapy all my life. but I was finding that it was harder and harder to get the space and the time and the agreement of my managers and the NHS as a whole to give me time to work with people rather than just nurse them, whatever that means to people.
Yes.
And that became ultimately quite unsatisfactory.
Wow.
The job itself is fine, but the actual ability to have a difference in people's lives, make the life different from what it was, wasn't the nurse. And that's why I wanted to do something more.
So you'd been in mental health for around 40 years.
Yeah. Still do it. I still do it. Semi-retired, I still do it.
So over 40 years, or just over, because I also got married in 1983, so I can work out the maths quite easy because I get told regularly how long I've been married. So you've seen mental health and all aspects of it. Now, one of the things I'm aware of, being a hypnotherapist for a long period myself, is there are some conditions we wouldn't work with, which are definitely where the NHS should be servicing people, but there's a lot of work, particularly solution focused work, which could be brought to bear to support that really well.
I think you're absolutely right. I mean, we talk about the psychosis, schizophrenia and others. And I tend to agree that there's a specialism there, that it should be a psychiatrist for the treatment of the psychosis. But what we don't discuss often enough is the after effects of being psychotic, the sense of self, the sense of who I am, what I am. And that's not treated very often in the NHS. In fact, it's not. And although when I trained with you, it was quite a black and white line. We don't treat people with psychosis. We don't treat people with really deep depression. Actually, in the 5 years that I've worked, I've come to understand that you can do something for those people.
Yeah,
absolutely. At what level they're at.
Yeah, and I think the slight difference with you to, like, I've got no previous mental health training before I trained as a hypnotherapist, so it would have been very wrong for me to go in and go, oh, I can help people who are that ill. But it's like people who have got really deep training of working with children or working with neurodiversity. They can bring their experience to it once they're qualified, as you did. And that's the difference. So the more people with your depth of knowledge, that would definitely add to that flavor. So that's good. But from a standard hypnotherapist point of view, we would not work with somebody in that psychotic state. They need someone with your experience.
Yes, yeah. And again,
in the right place.
Yeah. And I often worry about this in my day-to-day job, that we talk about cure. You don't have to set yourself up for that. You don't have to say, I'm going to cure people. I'm going to make a difference to somebody's life.
Yes. And when we can't cure people, a state of mental health is a state. So it moves up and down, a pendulum swings for different people. And it's not about moving them to a solid space the whole time. It's about putting control in, I believe, so they have more likely to maneuver that pendulum to where they need it to be the best of themselves.
Yes.
And that's our target, is to help people be the best of themselves, therefore control and therefore change their lives. So you're absolutely right.
Yeah, and on my advertising, you'd see at the end of this session, my strapline is getting you to where you want to be. I don't need to know where to be. You need to know where to be.
Yeah.
And I'll help you there. And I think that's what we do as a hypnotherapist.
Absolutely. So one of the questions I'm asking people is, I mean, you've already said you decided to do some training in hypnotherapy, and you looked online and you stumbled across CPHT. But what made you choose CPHT? What was it compared to any other hypnotherapy training? And there is different modalities.
A few things, actually. The first was, I had two things in mind when I first started looking at hypnotherapy training. The first one was, it was in-person training. I didn't want to be sitting at a desk reading papers online or getting things sent through the post. As an individual, I'm a visual learner. I need to be able to sit down and see what's happening, talk to people who are doing it, and copy that, modeling sometimes. And the other thing is, which is really a silly thing, it had to be local to me. I didn't want to be traveling 5 hours or 6 hours to get to where I was going to train.
Yeah, absolutely.
So, you know, when I came across you, you were, I think, 19 miles from my door to your training door. So I
Yeah,
thought win-win situation. The other thing is, I talked to you on the phone. I remember
right.
ringing you up, talking about solution-focused hypnotherapy, not really knowing what it was. I knew what solution-focused brief therapy was because of the job I do. I didn't know
Yes.
it very well, but I'd come across it. You know, the miracle question. I've done all that. And having spoken to you, and then having the chance to sit down and think, well, you know, solution focused, brief therapy, hypnotherapy, look at the marriage that there is there. That's what give it to me. That's the idea
Yeah.
that I thought, I can do that. That's what I want to do. And
Yeah.
also having spent years and years in the job, and when I first started nursing, it was Freudian psychotherapy that people were.
Yes.
And I didn't think that 5 years of weekly or twice weekly work, or talking about all the things that happen to you to bring you to the couch or the chair was good for you. Why would you want to unearth that every time and just put people back to where they started? The forward thinking, the solution part of the job, the training. Yeah, let's leave behind, because when I talk about solution focused hypnotherapy to colleagues and people I meet, I always say, you know, the patient comes to you with the problem, they know what the problem is, and somewhere inside of them, they'll know the answer.
Yes.
Just needs me to help them get to the answer. So I don't
Yeah.
need to unpack it every time. I don't need to bring up the trauma, bring up the hurt, bring up all that sort of stuff. I just need to help them get to where they want to be, and
Do,
that's what made me choose solution focus.
do you think your extensive experience of working with people who had different mental health challenges, different issues going in their life, watching the treatment they would have received, different expectations, working with people who'd been through different therapies within the NHS and things like that, gave you any insight into what you would and wouldn't want to be doing yourself?
Yes, I think you put your finger on the pulse there. I wanted to make sure that what I did do was beneficial to the patient. In my experience, and I hope people don't take offense to this, that some people become therapists because they want therapy themselves,
Yeah,
and sometimes they just want to feel nice about themselves. Absolutely fine. And I get a
yeah,
bit of that myself when I do my job. But
yes.
actually, my drive and force, as it has been for many years, is to help other people. And I think that's what we can do in solution focused therapy.
Absolutely. And I think, there's so much evidence of that.
Hmm.
But I'm interested in to see how you, because you're one of the rare people what I've had interaction with. So as I've said, when I trained, I only had the the experience of watching people who I might have known with mental health issues or things like that. In fact, even I've been doing this for 13 odd years, and it was still a little bit hush hush then as well. But you was at the sharp end of watching people with a lot of serious mental illnesses, looking at over 40 years what services were provided to them when they was in hospital, when they was out of hospital, what they were discharged with. Did that help inform your current practice?
Yes. When I first started as a mental health nurse, we didn't have many therapies at all, really. It was medication.
Yeah,
Um, and in those days, it was give them lots of medication to try and bring the level of illness down, as it were. And over the years, it's all changed. We now would admit people, or would see people without actually thinking about treatment.
mm,
What we haven't done is to develop a good community-based
yeah,
rehabilitation or service. We we get the better in the wards and we discharge them, and they may be given some follow up, they may not be given some follow
yeah,
up. Quite often they're given a card saying, "Ring this number if you want any more help."
yeah,
And
yeah.
people in distress don't ring numbers.
No,
People
no,
just don't do that. So
yeah.
I don't think we are as good at community care as I'd like us, but we're better than we were.
Yeah, we are. But that helps you inform where you wanted to go and how you want to help people. And that's brilliant to hear. You brought all that knowledge and experience to a place where you could carve out a support system in, how you work, which is fantastic. Um, you know, when you was training, What was it, what stuck out in the training for you once you were training, which made you go, yeah, I made the right choice?
I think for me, it was listening. I'm not blowing smoke yet, but I think listening to you and your enthusiasm for the job, also your understanding of what we as therapists could do for other people, and how we could enable people to have a different life from the one they brought into the first session.
Yeah, yeah,
And that's a really important thing to me, that we can do things for people that maybe other therapeutic models, other therapeutic individual services haven't been able to do. Or
yeah.
weren't interested in. Yeah.
So one of the things you've said, and I'm sorry to harp on about it, but it's such an important thing, is because you've got multiple years of knowledge of working, and you've seen the mental health services change and develop, evolve. You're now a clinical hypnotherapist. We in solution focused hypnotherapy is very tightly tied to neuroscience. So we are continually getting reinformed of newer, better approaches. So what will you be doing to keep up with those current developments and as the field changes and gets better?
I still read every day. I'm currently reading another Yapko book called
Yeah,
Process Orientated.
yes. Yeah,
Very,
so Michael
very,
Yapko really over the years really moved towards a solution
yeah,
focused
yeah.
approach.
It's interesting
He
to see.
has very much developed.
I still do CPDs with
Yeah,
the service. I still talk to colleagues in solution focused therapy via the Facebook page and via the um,
yeah,
vision groups. So yeah, I do lots of things to keep myself going. And also, solution focused therapy is gaining a bit of traction. You've done some research; it's becoming a bit more mainstream now. So
yes, it is.
more and more articles about it.
Yeah,
So yeah, I think it's an imperative for any therapist to make sure that up to date with their training, they're up to date with modern belief systems. The neuroscience changes almost every day, doesn't it?
yes, it does.
But people in the team that understand that and can explain it to us in easier ways, because it can be quite daunting, I think, sometimes.
Yeah, very much so. We try to continually, whether it's me, whether it's one of the other lecturers, one of the people doing the CPDs, we take that higher level sort of inquiry down into what's palatable to understand. And I think we do quite a good job on that, but it's always moving forward. And I think part of the solution focus approach, it's always using the best available tools. So that's really good.
And
So
that's interesting, because one of the things that we do as therapists, what I like to think we do as therapists, is that we develop a partnership with the person we're working with.
yes,
And a treatment is a partnership.
yes,
Things about partnerships, you can share things. So I always talk about, here's the hippocampus, here's the hypothalamus, this is what it does, this is what we're going to do with you. And you can see them thinking, oh, that's right, I understand that now. So they're halfway there.
yeah. And
Interesting.
that's a powerful part, isn't it, about that, that neuroeducation.
Absolutely.
Which again, I think that's lacking in a lot of services available to people. So they don't understand how to help themselves. So, that's really important part of what you deliver is that neuroeducation.
I've never come across it in the NHS.
Yeah.
I mean, I'm sure it happens occasionally in some places, but I've not come across it as a part of a treatment model.
I think it'll be more down to the individual rather than the policy.
Yeah.
So with all of that stuff you do, and you've said you're semi-retired, how do you manage and maintain your work-life balance?
I think that's the joy of being self-employed as a clinical hypnotherapist. I'm self-employed. I don't have to meet the demands of the trust that I work for. I don't have to meet the demands of anything else. When I want to work, I work. When I want to make a decision that I'm only going to see 6 people this week or 10 people this month, I can do that because I'm self-employed. And doing that frees you up to do all the other things that you want to
Yes.
do. There's no targets to meet. There's no pressure from a manager, apart from my wife, who thinks I should do more options. It's just I work for myself and I do what I want to do. And it's such a freeing experience because, like I said, I've been doing the same thing for 40 odd years. And you clock in and you clock out, and you have to do this, and you have to do that to tell people like you're doing your work. And I come home and I think, well, okay, I'll see these people this week, or the next 5 or 6 weeks or 10 weeks, whatever it takes. And then have a few days off if I want to. So it's a
Wow.
really different way of living your life. Much
So
more
do you feel
pleasurable.
more in control?
Oh, every day, yeah. Every day I'm not working for the NHS.
Yes.
I love the NHS. It does a great job in society, and it's done me proud over the last 40 odd years. But
Yes.
the idea of just doing it for myself is a much bigger dream.
So one of the things is what we'd like to ask is during the time, so since 2019, you've been working as a clinical hypnotherapist and things happen. So have you got a success story that stands out for you when you've worked with someone? And I always find it because, some of the people who've been on a training course are psychologists and this, and they've, and they go, oh, this happened. And they've been a psychologist for 20 years and they've never experienced these types of things, or is there anything in particular that you specialize in helping with and that's given you ability to do that?
I don't specialize as such yet. I'd like to do sport therapy. I think we've discussed about this before, but I haven't gotten there yet. But I remember on the training course, one of the most common questions in the first 2 or 3 months was, how long is a session? How long does it take to cure somebody? How long does it take to work with somebody? And your answer and the other trainers would, sometimes a day, sometimes 10 weeks, sometimes 20 weeks. And I'm thinking to myself, one day, you're kidding me, aren't you, really? You're kidding. And then it happened. I got referred a young lady. She was in a dead-end job, didn't like it, didn't want to do it. I had one session with her.
Yeah.
Within 3 weeks, she'd left that job and she got a job in a Paris model agency.
Wow.
Exactly. Wow. And I can't believe it. I even got an email from the lady's mum saying, thank you for bringing my daughter back to me. Thank you for doing what you did. But it was just, one session, 1 hour. That's what it was. 1 hour.
Yeah.
And
And that's quite a rarity because
yeah,
we would normally see people 6 or 8 sessions.
yeah.
It's still very speedily when you're talking about mental health. But sometimes it's just that explaining to who they are, what they can do, and they go, oh my God. And it's just that tilt some people needed. They wasn't really mentally unwell, but they didn't feel in control of their lives.
Absolutely, absolutely. She felt that the locus of control was outside of her. And
Yes.
after one session, the locus of control was back inside her, and she could do what
Wow.
she. And equally saw a chap who was a drinker for 30 odd years. Not to this point where he was sitting on a park bench with a bottle in a paper bag, but to the extent where it interfered with nearly every aspect of his life: relationships, keeping the job, looking after kids, all those things. The chap in Abu Dhabi. And we had about 10 sessions, and we just went through the science. What does alcohol do to your system? What does it do to your executive processing? All those things. And he stopped. He stopped drinking after, I think it was 8 weeks, and we had 2 more weeks to just,
Build on that,
get it in.
consolidate that knowledge.
And he's still dry.
Yeah. And those moments, I don't know how you feel because you've helped people all your life, but those moments where it really changes because, when I work with somebody like that, it's not the impact I have on the person. It's that spider's web effect. How many, you talked about his children and his colleagues and,
Yeah, it's the ripples in the pond, isn't it? Ripples
yeah,
go. Yeah. It's interesting to
just
say. It's interesting to say that about you work with people. Like in my ordinary job, the nursing job, I work as part of a team, and I can take a little bit of the kudos for making somebody better and getting them discharged or getting them well. But when I'm working as a solution-focused hypnotherapy, it's all mine, and that makes me feel a bit different. I get that sense of, well, you did a good job there. That was
oh,
you.
I don't know if this is a case for you, but I was working with somebody who trained with us, was a doctor of psychology within the NHS. And then she trained with us and she started working with somebody who had PTSD, some level of trauma. And I remember her contacting me and going, that's never happened before. Because she got this guy who'd come in and said, I've got PTSD, can you help me? She worked with him for whatever amount of sessions, and to the point where, just like that young lady, I'm the best version of myself now. Thank you. And she said it's never happened where you get somebody from the first contact to last contact. Normally, you get given, this is your person, work with them until you get to this point, and then pass them on to the next person. It's a sort of like a production line almost. I know it's not like that.
But there's no direct access to NHS mental health services. You have to go through your GP, you have to go through maybe an outpatient clinic, then you may be assessed for a lower level of CBT, computerized, manualized CBT, and then you may be passed on to somebody more experienced and capable, like a psychologist. So there's no direct entry treatment in the NHS.
But even when you get somebody who's broken, as soon as we're a bit better, you've done your job and you move them on to the next person. And I never knew that until she explained that to me. You never see someone finish.
You don't. It's up the hill getting there, and then it's up the hill getting out. So you just never get that one touch to it.
Wow.
One course.
And I don't know how that makes you feel. And, that was life-changing for her as a therapist, as somebody who wanted to help people, because she saw that she could see somebody from first contact to last contact, taking them from their worst being to their best being.
Yeah.
And just see it all.
Yeah. I mean, and what does that do for your own sense of self? The fact that this person has come to you and from A to Z is just being you, and they are much better than when they first met you. How does that make you feel as an individual? Got to be good. Got to be good.
Absolutely. And that's why we do it to help people, but we want to feel good and validated. So I've got another question for you then, which can necessarily be the opposite to that. How do you, and I don't know if you've seen a lot of this because you work a lot in the NHS, how do you handle skepticism, either from potential clients or the general public or your colleagues, about hypnotherapy?
So people are always skeptical about hypnotherapy, I think, unless they've already had it and it's been successful. So for me, the first one is to ask, have you ever had hypnotherapy? And most people will say no, because not everybody's been. And I always say, well, do you want to try it? Let me put you in 20 minutes of trance. Let me let you experience what it's like to be in trance. And then you'll know that you're not going to wake up, act like a chicken. I'm not going to make you into some sort of a killer. I'm just going to make you wonderful. And then there's those people who've been in hypnotherapy and didn't get a beneficial effect from it. And I will talk often about what sort of therapist it was, were they trained, how did they train, where did they train, what did they say to you, did they explain what hypnotherapy is, did they explain what trance is? Because it's surprising how many people have no idea what trance is. They see it on TV again with the old man with the watch, the waistcoat, the little gold watch across his arm.
Or the stage hypnotist.
Or the stage hypnotist, yeah. I mean, they've done us no service at all, really. And so then I talk to them about that, and then I describe what I do about how what trance is. It's a different level of consciousness. It helps you focus on what we're talking about and gives you a deeper understanding. I don't often talk about conscious and subconscious because I'm not really sure they exist as such. I talk about the different levels of your awareness, and then as often as possible, I put people in trance. I do the work and lunch hours and things. I put people in trance and let them understand it. And then just say, when you're ready and you need some help, come and see a proper trained solution.
So you're happy to demonstrate so people can go, oh, wow, that's not what I expected.
You know as well as I do, you can put somebody in trance in 15 minutes.
Yeah. It's the simplest thing we do.
If you haven't got 15 minutes through the working day, then your job's worse than it should be. Yeah. I do it at lunchtimes. I do it just sitting with people. Yeah.
So you're the first person, though, who said you actually do it with a practical demonstration of what you do. Most people have said they use the science and talk about how the brain works, and because I certainly do, because a lot of people have been so misinformed, and there's so many misconceptions about what we do. When we start talking from a clinical science point of view, they go, oh my God, I didn't know that was involved. I thought it was just, walking around like a zombie. So, but you sound like you've got that handled really well.
Yeah, you've got to have a mixture of the two. You've got to say this, there's science behind it, and then you experience it as a person.
Do you get the people you just can't convince, and what do you do with that?
I don't stress about it. It's
No,
okay. Exactly
it's
what
up
can
to, yeah, exactly that. It's like, don't try change what you can't change. Well, you can't argue it.
yeah. I mean, hopefully, or not hopefully, but there might be a time when they need hypnotherapy, and
Mm.
hopefully they'll come back. But if they don't, that's absolutely fine as well.
So, on a personal note, you come along, you trained as a hypnotherapist. Um, did that training and since working as a hypnotherapist affect you? Have you changed? Have you had any personal experience from hypnotherapy training?
Yeah, it changed me dramatically, actually. Although I've said I've got a reasonably good experience in the NHS. I've been I joined as a support worker, working on the wards, and then I became a senior manager. But I always had a more than my fair share of imposter syndrome.
Mm,
I'll be found out one day I'm not good enough to do this. I shouldn't be doing this level of work or this type of work. And then when I came into solution focused hypnotherapy, I knew that I should be doing that sort of work. I knew it was a different thing. And that's trickled over into my daytime job now because I don't feel that anymore. Uh,
wow.
I don't tell people I'm the best person in the world because I'm probably not. But I know inside myself I'm pretty good now. And
Yes.
before I had that thought. So yeah, it's made a huge difference to me as a person. Um,
That's amazing. And I didn't know that. And
it's not
because
a sort of tell
it's
people,
not
is it?
something you talk about, is it?
I've had a couple of conversations at work in the canteen. We've got a little room about the size of a telephone box where we make teas and coffees. And I spoke to one lady I worked with a lot and talked about that. She, to a degree, suffers the same. And she was exactly the same as me. She'd been in the job, I think, a year longer than me. Had got to quite a senior level, but still had that imposter syndrome. And it was such a refreshing feeling to know that I had that, but don't anymore. I put that down fairly and squarely to solution therapy.
Wow.
I can do it.
That's amazing. You know, it's you can't buy that. I don't know.
No, if you
You
could,
know.
you'd make a fortune.
Yeah.
You
Well,
do that.
I think you can come and see one of us and or come and train with us, but I don't think you could tell people that. I don't think anybody will believe the because you didn't train to become a hypnotherapist to improve yourself, as in
No,
you
no.
wanted another skill, another set of knowledge, um, and you've walked away from it a better version of you as a side
You
effect.
Absolutely. Like I said, I'm not banging on about this, but I've done 40 odd years. So I knew who I was. I knew what I could do and what I couldn't do. And the thing about this, the imposter syndrome, I was at ease with that. I was settled with it. It's part
Yeah.
of me, like having a dodgy right eye, I can't say it properly, and having, a bald head. Nothing I can do about those sort of things. But then come to the training and realizing that actually becoming a clinical hypnotherapist is something I can do, and my success rate is 100%. I've never failed so far.
No, and you won't because you one of those people who really understand the process and use the process well.
I like to think so, yeah. And yeah, and then that just trickles into life. Yeah.
So during your training and possibly since, where did you feel you were supported during your training by CPHT, by the lecturers, by your peers? Was there an ongoing support from the cohort, from your trainers?
Constant. I mean, that's the important thing about CPHT, I guess. I've only got experience of your training, so I don't know what the other trainers do, but I'm guessing
We're
it's
all the same. Weirdly, we're all the same because we're all trained in the same way.
yeah. So from the first day when I spoke to you on the phone and you explained what it was about, to the first time I met you in person on the first day of the training, all the paperwork was there, everything was in place, all the manuals were there, everything I needed to think about being a solution-focused hypnotherapist was there. Then we got the telephone numbers from you and the other trainers. We could call up any time. We could Zoom anytime. We were able to have our Facebook page, which we did for the first 9 months while we're training. And then we moved on to the CPHT Facebook page. Everything's there for you. All the training's in place. And there's no such thing as a stupid question. And I'm one of the people who worry about stupid questions.
Yeah.
But there's no such thing as a stupid question.
No, and in fact, as a lecturer, we love stupid questions, because if you're thinking it, someone else is. And generally for me, if you're thinking it, it means I've missed something in the way I've told you it, or the way so it's left you confused. So I need you to ask me the question so I can clarify it better in a different way. How did you find the other students?
They were such a mixed bag. It was quite refreshing because, in the job, you do the training, you're always going to meet a nurse, a psychologist, an occupational therapist, a physiotherapist, a dietitian. They're all going to be health-related backgrounds. But I remember in my training course, I had an ex-taxi driver.
Yeah.
I had a guy who ran his own business in Norwich. I had a lady who was a dentist.
Yeah.
So a lady who was I'm pointing because I'm working out where they were in the room, so it reminds me. I had a lady who ran a little gift shop. Got a guy who, the dentist's husband, worked in a factory. So it was a complete mixed bag.
Yeah.
The commonality was that we all wanted to do what we were trained to do.
Yeah, and we work very hard. I certainly do when I speak to people, almost to put people off, to make sure they're fully aware of what this is. And it's we want people to be very successful. We want people, because if you're successful, you get that 100% success rate. That means all the people you see are better. And we really are passionate about helping people, and we only want to train people who really want to make a difference. So everybody who ultimately comes on the course are there for the same reason. And I think every single course we've ever delivered, and I've delivered 70 odd courses now, everybody's there for the same reason. They want to be better.
Otherwise, when you made that first internet search, they wouldn't have, you can't just stumble into it. You've got to want to do it.
So what did you do, or how did we help you prepare? So you spent decades working within a huge, probably the biggest organization in the UK, I think, the NHS. So everything's always provided. You'll get told what uniform to wear, what wall to work on. So you're, to a point, almost institutionalized. I'm an ex-serviceman, so I get that. And then it's like, I've got to work for myself. I've got to set my own business up. What do I do? How do I do that? How do I get a client? How did you find what we did on the course, or you did on the course, supported you moving into that new world of working for yourself?
So at the time, I didn't realize what you were doing. I remember that after month 3, we had to start looking for our own clients. And that imposter syndrome really hits you then. Am I going to be able to do this? Have I got the skill base? Have I got the knowledge base to actually sit down and see people? I know it was free. We didn't charge people, but that clinical experience, that in vitro real life experience was the most part of my training, that I could actually take the skills I'd been given by yourself and the other trainer and take it forward and give it to other people and work with them. And then there was the just daily discussions. I'm saying daily, we didn't train every day, but every time we met, have you thought about this as a sort of website? Have you thought about this as some online presence? Have you thought about tax? Have you thought about, I'm really sorry. Have you thought about where you're going to have your practice? Is it going to be online? You've got a room, you've got 2 chairs, even to the silly things like, well, make sure you've got enough blankets and towels to keep people warm. Their temperature just drops sometimes. But everything that we want to ask, you give us an answer to. And we just encouraged all the way through to think, you're going to specialize in this, you're going to work with children only, or very old adults or sportsmen, everything was, no matter what question we asked, there was an answer. And most importantly, the answer wasn't just an answer, it was a suggestion of how to do it. And that's
again, because we want you to be practitioners. But one of the things which does set us apart from all the other schools is the fact that you have to work with people from day one. You start practicing those first day on people, friends, family, and then you graduate. But by the time you graduate, you've worked with a few dozen people and you've got clinical confidence and competence. Unfortunately, I see lots of people come on our training courses who've already trained elsewhere, but they've got no confidence because they've never seen a live client, or they've done the training online, and so it's not, it's not fit for purpose. So that makes me very happy that you did that. Since you've qualified, has that continued in any way?
It has. We've got the regular supervision groups, which I attend as often as I can, really. And even now, after 5 years, I don't class myself as the greatest clinical hypnotherapist in the world. I still learn something every time I come onto the session, and it's just this particular compound has been discovered in the brain. We think that it does this in the brain. That's something new I didn't know before, and I'll tell people. If it's a particular way of speaking to somebody, have you thought about approaching that particular problem in this direction rather than this direction within the bounds of solution-focused hypnotherapy? Then that's something new. The other thing, of course, is the CPD, the amount of extra training people can do via your service is just amazing. I'm doing the advanced diploma at the moment.
Yeah, so there's lots of support.
And telephone, I can call anybody anytime.
Yeah. Oh, yeah. Well, everybody's available for you. And I think that, and it's such a family's the wrong word. It's the easy thing, but I think CPHT, once you get involved with CPHT, the level of support from loads of different directions, not just the people who trained you or even your supervisor, it's generally very supportive as a community, because we're all like-minded, So what do you find most rewarding about being a solution-focused hypnotherapist?
Being a solution-focused hypnotherapist, I find the most rewarding. That's a bit twee, I don't mean it to be. I can remember having a discussion with my boss a long time ago saying, I've discovered this thing called solution-focused hypnotherapist. And in my job, we come across lots of EBT, EBT, any three-letter acronym, And I said to her, this is the one that I can wholeheartedly support. So I'm just going to accept it. I'm going to believe it. And I do whatever I do within the bounds of solution-focused hypnotherapy. And that's what makes me feel happy, because I know that it's proven, it's effective, it's short term, in the sense 10 weeks rather than 10 months. And it gets, and I keep saying this to people, it gets people from where they are to where they want to be. And I can't ask more than that, really.
Yeah. And it's a nice product. So what advice would you give? Someone's now in that position, they've read something like a Yapko book, or they've had hypnotherapy and I could do that. What advice would you give to somebody considering a career in hypnotherapy?
It's interesting that last sentence you said, I could do that. My answer to them always is, well, why aren't you? Get online, CPHT, here's the people that train me. Get online, book a course. At the end of the day, you're going to leave the course with a vast bag full of skills. You may not go or may not want to go into private practice. You may want to just see one or two people, may not want to make a career of it. But you have all the skill base, you have all the knowledge, all the learning, and the ability to do it. So just do it. What's stopping you?
Wow. So
I wish I'd done it 30 years ago.
Sorry?
I wish I'd done it 30 years ago.
Yes.
The course wasn't available then, but I wish I'd done
it. Well, I did mine when I was my mid-40s, and it was a complete 180-degree turn for me. And you know some of my history, we spoke before. But a very, very good friend of mine said to me, the teacher appears when the student's ready.
Yes.
And I wish I'd done it at school and wish it was him, but actually I wouldn't have been ready to be able to do what I was doing until I did it. And I think that's what it is. When you know, you know.
And I think that's when people ask you about, oh, could I do that? The fact that they're interested in doing it is telling that, yes, I'm ready to do it now. So
yeah,
just get on and do it.
yeah.
Just get on
So
and do it.
in a moment, I'm going to ask you to give us all the details of where we can contact you. But I didn't send you these, and I've done it to everybody. I've got another question for you, which I haven't told you about.
Go ahead.
Okay. So, if you could have hypnotherapy sessions where you delivered the therapy with any historical figure, who would it be and why?
Oh, what a really good question. Wow, what a good question. One of my heroes are the Beatles, who I'd probably want to deliver to John Lennon. So I think he was tortured. He was a wonderful songwriter, wonderful musician, but there's something about his soul, about the way he presents. You can see the torture in his eyes.
Yeah.
And I'd just like to, I mean, he's still going to die. That's history. Can't help that. But just to give him some difference in his life before he went off. Yeah, that would be it.
Wow.
I mean, there's a few other people, but yeah, it's a
So,
hero.
yeah, yeah, no, absolutely. I'm just really pleased that you didn't say Donald Trump, because you know we're very good at what we do, but there are limits.
Yes, absolutely right. Yeah, you can't work with the likes of Trump.
Yeah. So, I mean, I've asked that question of people, and everybody comes up with somebody different. John Lennon's amazing, and actually, you're right. Part of you could see his whatever his anguish,
Yeah,
which was sitting behind
yeah,
everything else. So
yeah.
yeah, he would
Comes
have
up
been
with songs so simple, so clearly. Yeah.
it would be fascinating, that would be. So, Kevin, thank you for today. Now, some people would be, particularly as you've got this global business where you work from this little tiny village in Lincolnshire, but you
A little
reach
tiny room.
in a little tiny room, but you reach globally. How do people find you?
So my company name is Provision Solution Hypnotherapy, and that's it really. I have some socials and I'm online. Just
So
Provision.
Facebook is called
Yeah,
Provision on Facebook.
Hypnotherapy.
Yeah,
Provision
Provision.
Hypnotherapy. Yeah.
Yeah. So what we'll do is if I'll make sure they're also in the text of the uh, YouTube text and everything I do, so people can find you and link to that. So that would be fantastic. So I'd just like to say it's been a pleasure as always. And what we could probably talk for hours. So massively appreciate it. Thank you very much,
You're
and
welcome.
I'm sure we'll speak soon. Thank you.
Harry, have a good day. Take care of yourself.
Thank you.